Very good afternoon to you, Jamie. Jamie, as we were just saying, we've now got confirmation of more strikes. What impact are these strikes having on the healthcare system and therefore on patient outcomes?
Yeah, good afternoon, guys. So the first thing probably worth covering is the fact that we've had the latest, we get weekly figures kind of on ambulance kind of response times and looking at the system across, and this is up to the 18th of December. So this kind of predates the most recent strike that we've just had. So we've had about 69,000 patients arrived by ambulance in the 7 days of the 18th of December. But the kind of striking figure now, and it's getting worse overall, and remember this is before the strike, is 1 in 4 of those patients are sat in the ambulance for more than an hour. And then if you tot up all the time ambulances are sat outside hospitals in that week, you've got 46,000 hours now. 46,000 is a huge number. There's a lot of ambulances, but there's 46,000 hours lost, but just the ambulance is sat there and they can't hand the patient over to the hospital. Now, what that means then is when the patient's in the ambulance, if you phone for an ambulance, you hear the stories that people are having 20-hour waits. If they've had a fall, we've seen them across the media for a while now, but it's getting worse because obviously if the ambulance is stuck outside the hospital, they can't do anything. And a lot of this is linked back to, we've got a lot of patients now, about 13,000 patients in hospital ready to leave, but there's no social care in the community. And what the strikes do there is that they say they respond to the category 1 calls, so those are the most life-threatening calls. But it's those category 2, 3, 4 calls that won't be taking place. And you look at the category 1 calls, just to finish there, which is what you call the most life-threatening calls. The target is to arrive in 7 minutes, but it's getting worse and worse and worse. The latest figures for November, the average response time was 9 minutes 26. These are people who are having cardiac arrest. So it's going to get worse. The ambulance strike we've had recently is not going to help the situation. And going into January, it's going to get even worse.
We had the ambulance driver strike yesterday. Was the arrival time for ambulances affected that badly? Because we've been hearing that ambulances are taking way too long to get to all sorts of people and have been for many, many months, if not years. So are these strikes making it worse or just perpetuating what was already going on?
Well, what we will see, Kev, is the figures in a couple of weeks' time for what actually happened on strike day. That'll be quite revealing. But kind of anecdotally from what the system has been saying is that the number of 999 calls was significantly down. But obviously, if you have a cardiac arrest, you need that ambulance. People who probably have chosen not to. I can't imagine, Kev, you're not going to decide to get drunk over Christmas. I'm sure
absolutely not. No,
having a few. But ultimately, it's going to.
Your nose growing.
It's what we're going to see across the system, and it is. The NHS is in a bit of a crisis, Kev. We've spoken about this the last couple of years. You've got, about 95% of the beds are full at the moment. We are seeing rises in flu and COVID cases across the hospitals. It's not as bad as what it was during the pandemic, but these strikes are not helping the situation. And ultimately, what happens is, if you get these delays across the system, even when you get into the A&E themselves, I've talked about the delays in getting into the ambulance, from the ambulance into the hospital. You've got significant delays in the accident and emergency departments. And we know from lots of research, you get those delays, patients die. And we've seen excess deaths across the country now for about 30 odd weeks, and it's getting worse.
On those excess deaths, I don't know if you have those figures at your fingertips. I was just wondering what they look like, the excess death figures.
Yeah, well, they've been going on now for about 32 weeks across the country. And what we kind of more worryingly is we've had a couple of COVID waves across the summertime and during the early autumn. And if you take those deaths out, because we do know COVID still disproportionately does kill the elderly, even despite all kind of the people who've had infections and vaccination. But if you take COVID deaths out of the figures, the alarming thing is we're seeing kind of higher deaths than what you would expect among people aged 30 to 60. Heart issues are coming up as part of that. And then obviously with the delays in getting to people if they got heart problems, every second counts. And you've got this 9 minute 26 kind of is the average response time when the target is 7 minutes in England. And those seconds will count. It's actually worse where I live over in Wales. We've had the latest figures. They're back in October. It was over 10 minutes. And we're talking about these delays now. And when the figures come in for December, especially with these strikes, I imagine the situation's getting worse because these delays of ambulances not being able to hand over patients, that's getting worse as well.
And so Jamie, are you saying that the spike in the 30 to 60-year-olds of death with heart issues. Are you saying that those spikes could be connected to ambulance response times?
Well, that was one of the things that could be going on, because we know the health system's really been struggling over the last 30 weeks. The ambulance response target of 7 minutes, now that's been breached since May 2021 in England, but it is getting worse and worse and worse. So that will be one factor. The delays when you get into the accident and emergency will be an issue as well. And you know, we need to be shining a light on this. Another Department of Health has said they've been looking into the figures, but you know, this is kind of a national scandal, and it's something that you know, we need to shine more of a light. You remember, we had every single day across the kind of the mainstream media how many deaths within 28 days of a COVID test, all through the pandemic up until kind of the start of this year. But there seems to be little kind of interest in what's going on with all these other lives. And you know, every life obviously matters. I think the government really needs to get a grip of it. And the health system is clearly not helping the situation. And the strikes are only going to exacerbate that.
Yeah, only a couple of weeks ago, the Chief Medical Officer, Sir Chris Whitty, said that there were excess deaths, and we would have to get used to there being excess deaths for a prolonged period of time. And then he had the temerity to say this is due to the lockdowns. It's an effect of the lockdowns. He didn't mention that the lockdowns are all down to him, that he was the architect of these dangerous and damaging lockdowns that seem to have had terrible effects in every single area. Jamie, great to talk to you.